So we're going to go ahead and look at some different strips now and see if we can look at how we're counting our heart rates and how we're measuring our intervals in more detail. So when we're counting our heart rates, as I mentioned, between two hash marks is 3 seconds. So between two sets of them would be 6 seconds. So if I measure from here to here, it would be 3. If I measure from here to here, I have 6 seconds. It's always going to be easier to count your heart rate with multiples of 10. So you're going to count how many QRS complexes. Now, normally we assume that you have one P wave to one QRS, but that's not always going to be the case, as we're going to learn as we go through some of these rhythms. But generally, when we're looking at what is our heart rate, we're looking at how the ventricles are contracting. How much work are the ventricles doing? So we count our QRS complexes. And if the entire QRS complex falls within our hash marks, we're going to go ahead and count it. So here I have 1, 2, 3, 4, 5, 6, 7, 8, 9 QRSs in that 6 seconds, so my heart rate would be 90. On this one right here, I would have 1, 2, 3, 4, 5, 6. So I would have 6 beats in that 6 seconds, so it would be a heart rate of 60. So it's one of the easiest ways to count your heart rate. Now, the most accurate is to count every beat in 1 full minute, but that obviously is not going to be practical. But if you're monitoring someone on a telemetry monitor or in a critical care area, when you see that heart rate is going across the screen, it does count every beat in 1 minute. So here I'm getting 90, your machine might be getting 94 or 95. We aren't going to be that accurate with a 6-second method, but if that machine is saying 94 and I'm getting 90 or I'm getting 100, I know it's probably counting pretty correct. If the machine's counting at 94 and I'm getting 50, then we've got a problem. Here on this example, now again, this would be 6 seconds. I would have 1, 2, 3, 4, 5, 6. So rate is 60. So because 6 times 10 is 60. And if you notice, one of the things you're going to start looking at is, are all your components there? Do I have one P wave to each and every QRS? And does my P wave look rounded, symmetrical, and the same all the way across the strip? If it does, I know it's probably coming from the sinus node. I'm going to be looking at, so I have a P wave, my QRS. Now here I don't actually have a Q, I have an R and an S, but I'm still going to call that the QRS, and then my T. So for my intervals, my PR interval, I would measure from the beginning of the P to the beginning of this QRS. Now, a lot of people use calipers, and that's totally up to you. You can also just put a piece of paper up and just mark on the paper from here to here and then bring it up to the dark lines. Sometimes that's easier to do it. Or if you can find a P wave that starts on a dark line, like this one right here, it goes up right here on a dark line. So I have 1, 2, 3, 4, looks like 4.5 boxes here. So 4 boxes would be, again, 4 would be times 0.04, so it would be 0.16, and I have another half box, so it would be 0.18. So my PR interval is 0.18, and my PR interval should be the same as it's going across the strip. My QRS, from the beginning of the QRS to the end of it, it looks here, and again, if you can find one that's just starting on a line, it works best. I have 1, 2, looks like just a hair over 2 boxes, and 2 boxes would be 0.08, so it's right around 0.08, 0.10, so that's fine. And then the other interval measurement we talked about was the QT interval, QT. So that is from the beginning of the QRS to the end of the T wave. And if I look at this one here again, so from the beginning of the QRS to the end of my T wave right here, it looks like I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 boxes. So that would be 0.40, which is okay. We said 0.40 or less is fine in normal heart rate ranges. So in this example here, now this here is only a 3-second strip. So for a 3-second strip, one of the things you're going to get used to looking at with your strips is, does it look regular to you? Does the spacing from this beat to this beat look the same from that beat to this beat? Now you can take a piece of paper, mark a hash mark here and a hash mark here on your paper, and then just run the paper across and should line up perfectly, or you can do it with calipers. But you can be fair, I mean, you can usually tell pretty much by eyeball whether something looks regular, evenly spaced, or irregular. So this is nice and regular. This one here, from this QRS to this QRS to this QRS to this QRS, it looks evenly spaced. This is only a 3-second strip, so my rate would be 1, 2, 3, 4, so I'd have to multiply by 20, so my rate would be 80. I've got one P wave for each and every QRS, and my P wave looks pretty much the same and rounded. It looks like it's doing fine. Nobody's waveforms are going to look exactly the same. Your EKG strip's kind of like your thumbprint. It all looks like a thumbprint, but everybody's has a slight variation to it, and that's what you're going to find with EKG strips as well. So here it looks like, if I looked at my PR interval here, if I look at this one right here, it looks like I have 1, 2, 3, oh gosh, it's really hard to tell here without calipers. This one here is almost on a dark line. It looks like I'm about 4.5 boxes, so 0.18. My QRS looks nice and narrow, so it looks like it's about 1.5 boxes, so 0.06. And then my QT interval here looks like it is, let's try to find one that's kind of on a dark line. Can't really find it. But it looks like I've got 1, 2, 3, 4, 5, 6, 7, 8, maybe, I'm sorry, I'm having a hard time seeing these real well, but it looks like about 8. I can't tell that was 8 boxes there because it's a little blurry. So that would be 0.32. Now, on a 12-lead ECG, the one thing, again, this class, we're not going to learn how to read 12-lead ECGs. We are looking at one view monitoring, but I wanted to show you how things can look different depending on what lead you're looking at things. So we tend to put our patients in lead 2 just because, again, that gives us a nice upright tracing. V1, which is equivalent to our MCL, you can see that, like here, my P wave is going part up, part down, which we said can be normal for MCL. My QRS, I've got a little tiny R, but a nice deep S wave. That's normal in an MCL. So, this is going to tell you what your heart's doing from multiple different views. So if you have a patient who is, for instance, they're having chest pain and you're thinking, okay, could they be having a heart attack? And you look at lead 2 and it's not showing any changes. It doesn't mean that there's not changes happening in other areas of the heart. So you always do need that 12-lead ECG when something's going wrong. So on this one here, as far as counting heart rates go, I have QRS to QRS to QRS to QRS to QRS is, it looks like it's evenly spaced. In 6 seconds, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So my rate's a little fast. So would be a rate of 120. I see that I have a P wave for each and every QRS and a T wave. Okay, and my P wave looks normal, rounded, and symmetrical. So I'm thinking that P wave probably came from the sinus node. Now this example here, and we'll be learning how to interpret all of these in the next few weeks, but I just want you to kind of start getting used to looking at your waveforms and your rates. On this one right here, it looks like my spacing is pretty even here. QRS to QRS looks even. In 6 seconds, I have 1, 2, 3, 4, 5, 6, so a rate is 60. I have one P wave to one QRS, but notice here from my P wave, that time lag from the P wave to the QRS is extended. And so when we start learning about what that means when we have those prolonged PR intervals, it's one of the reasons I'm telling you, if you don't measure your intervals, sometimes you can miss other things that are happening to the heart. This example here, it looks like it's evenly spaced. QRS to QRS to QRS looks evenly spaced. My rate is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So a rate of 140. So I can tell it's obviously going a little bit fast. And one thing you're going to notice when you start having faster heart rates is you notice here how the P of so the P here, I have my P, my QRS, and my T, and then that next P, that P and that T are coming really close to blending together. And next week, when we start looking at more rhythms coming from the sinus node, we're going to see that a lot of times when rates are really fast, those P and those T's blend together where it's even hard to differentiate them. Now this one here, this is another example of what I was mentioning. Even if you don't have calipers, you can easily tell that my QRS measurement, this QR to this R measurement, so R to R, QRS to QRS, versus this one, it's different. So here I have an irregular R to R. So I have an irregular rhythm. I have a rate of 1, 2, 3, 4, 5, 6, so a rate of 60. And when I'm looking at my P waves, it almost looks like I have some extra waves. Now, one thing when we were talking about U waves, for instance, a U wave is a small, tiny, subtle little wave that comes consistently across your entire strip. With this, if you notice, from this P wave to this P wave, that time interval is the same as from that one to that one, is the same as that one to that one, that one to that one, and that one to that one. So here, I just have some extra P waves. Okay, so when we start learning about our heart blocks, we'll learn how to interpret that a little better. And then this one here, QRS to QRS to QRS is regular. My rate is 1, 2, 3, 4, 5, 6, 7, 8, so rate of 80. But here you're going to notice I don't have a P wave. Okay, I am missing my P wave altogether. I have my QRS, and then I have some ST elevation, because my ST segment should be right down here, and then it goes right into my T wave. So this person has some problems, because we're missing our P waves, and we have some ST elevation. Now, a couple other things that you might see when you're dealing with monitored patients is this is called 60 cycle interference on this top little strip. And what happens is if someone is, they're shaving with an electric razor, or they're using, some type of electronic equipment, if it's not grounded properly, it's really easy to get 60 cycle interference with it, and it's hard to get a nice clean strip. Doesn't mean the person's having a problem. It's just picking up artifact from other things. This here is called a wandering baseline. So when a person's breathing in really deep, it may go up, and then they exhale really low and it goes down, and then in the inhale it goes up. And so the baseline, the spacing from R to R to R is still the same. It's not changing the rate. It's just picking up chest movement, because again, when you're doing telemetry monitoring, you're monitoring them 24 hours a day while they're brushing their teeth, while they're walking around, while they're doing other things. So it's going to pick up some movement. Straight baseline, you're hoping they just pop themselves off of their leads. And then, of course, we have a, sometimes what can happen on your monitors is when you put a patient in a rhythm, or in a, you hook up the electrodes onto the chest and you're monitoring them. Sometimes, especially in an MCL, because the biggest bulk of the QRS goes down, and sometimes if the T is still going up, what happens is the R wave and the T wave are the same height. What those monitors, your monitors on the floors, what they do is they're trying to pick up the QRS cycle. So it's looking for the R wave. So if your R and your T are the same height, what the machine's going to do is count, this is 1, this is 2, this is 3, this is 4, this is 5, this is 6. And it's going to basically be doubling your heart rate. So when you see that, you tell the machine, no, it's not accurate. And then it will recount it again. And you tell them, no, it's not accurate. And then it will start looking up other things to count it off of. So you do need to always make sure when you hook someone up to the monitor that what you're counting and what the machine's counting is correct. Those machines are amazing. They count every beat in a minute. They don't just look at a 6-second strip, but they can make mistakes. And that is the end of this section. So we will stop here.